Stan Havlick of Estes Park is a self-described adventurer, speaker, and philanthropist. He's visited every continent around the globe in his 80 years. He's an active retiree, but a recent pain in his abdomen sent him to the doctor for help.
For a number of months, they've had some discomfort in the abdomen, the lower area. And I was talking to a doctor friend, he did a little probing. He said, you know what, you should have that looked at. It's just going to hamper my life and it's uncomfortable a good part of the time. So I said, let's just address this and get it out of the way.
Stan had a hernia, as Estes Park Health General Surgeon Dr. Bogardus explains.
So an inguinal hernia is a defect in the abdominal wall that could allow either fat or muscle or even bowel to go through. It can cause pain, it can cause pressure and discomfort. Some people only see it. So they get this little bulge in their groin that keeps getting bigger and bigger and bigger. Or some people only feel a pain or pressure, and so they don't actually see anything, but it is there. We can see it on both CAT scans, sometimes with ultrasounds, depending on the size, or on MRIs.
Men are 10 times more likely to develop this type of hernia, which, if left uncorrected, can trap the bowel and cause serious issues. That's why Stan opted for surgery at Estes Park Health. After Stan is put under general anesthesia, Dr. Bogardus begins the laparoscopic hernia repair. The procedure includes 3 small incisions. The largest one, about an inch, is at the belly button. An anesthetic block is placed underneath the muscle and the fascia to target the specific nerves that innervate the abdomen. In a 1 to 2 hour procedure, Dr. Bogardus uses a lighted camera inserted through one of the holes to allow her to visualize what she is doing on a screen. The biggest challenge is getting her tools in the right place underneath the rectus muscle.
I do a special procedure called a TEP, T-E-P. So it's a total extraperitoneal repair of the hernia, which means I don't even actually go into the belly at all.
After the repair of the hernia, Dr. Bogardus places a mesh, a composite of sheep gut and polypropylene, underneath the muscle and below the layer of the abdominal wall to strengthen the repair and reduce the risk of recurrence. Stan will not need any particular rehab. However, the initial stages of recovery can be painful.
I always tell my patients they're going to feel like they got kicked by a cow for the first few days. But after that, it tends to get better every day. A lot of people don't even need narcotics anymore.
Stan went home the same day as his surgery.
We highly recommend patients to go home because then they're at home, they're comfortable, they tend to walk more when they're not attached to things, which we strongly encourage.
More than 1 million hernia repairs are performed by surgeons in the U.S. each year. It's a highly effective way to get rid of a nagging and potentially dangerous problem. Stan was pleased with his experience at Estes Park Health and happy to have his problem resolved. He will be back to enjoying his adventures.
And the whole crew was just terrific.
We're here, we're happy to help.
For expert general surgical care from highly trained community-based physicians, think Estes Park Health. Mountaintop medicine, quality care.